much more importantly, the patient had to be willing to let you. Only someone with enough courage, authority and experience, and who showed enough empathy, would be able to win that trust. And you had to be good with your hands. And that was where the chirurgeon came in, the man who could heal with his hands. Giving patients emergency treatment has remained part of the surgeon's work. Dealing with injuries and severe loss of blood, making sure patients can breathe and making them stable are still the primary tasks of surgeons in emergency departments in hospitals. This basis is clear and sound. Treating wounds, abscesses and fractures and giving emergency treatment to someone in acute distress results in grateful patients. But going a step further and performing an operation is a completely different matter. You don't heal a wound, you make one. A sensible surgeon and a sensible patient will weigh up the risks. Does the operation usually succeed or fail? Are there alternatives? What will happen to the patient if I do nothing? What will happen to me if the operation is a failure? It is always a matter of seeking a balance between doing your best and not causing harm. And yet, Roman consul Marius had a surgeon remove his varicose veins. He survived and continued to rule for many years. Surgeon John Ranby thought it advisable to operate on Queen Caroline of England's umbilical hernia, causing her to die a miserable death. Yet his Roman colleague was given a severe reprimand and was not permitted to operate on Marius's other leg, while Ranby was knighted for his services to the royal court. Surgery can be an unpredictable profession. Wounds, fractures, pus infections and operations leave scars, while diseases like colds, diarrhea and migraine can disappear without leaving any trace. This difference is illustrated by two different words for getting better. We use heal to make whole, to refer to operations, wounds, bruises and fractures, and cure to restore to health for diseases. Roughly speaking, a surgeon heals and a doctor cures. Surgeons have incidentally long been both doctors and surgeons, but they restrict themselves to problems treatable by surgical means, which are a minority of all the ailments a patient can suffer from. Most complaints do not require the intervention of a surgeon or an operation at all. The services provided by chirurgeons in the 16th century were so straightforward and limited that they could perform them as simple tradesmen in a small shop. In Amsterdam, surgeons were so insignificant as a professional group that they shared a guild with 3 other trades: skate makers, clog makers, and barbers. Until well into the 18th century, wounds, infections, and fractures constituted the lion's share of the limited range of complaints that surgeons treated. To that list could be added cutting or burning away misunderstood tumours and growths and, of course, bloodletting, the most popular surgical treatment which, however, had more to do with superstition than treatment. All in all, it was a rather simple and dull business. If I had been a surgeon at that time, I would certainly have taken much less pleasure in it than I do now. As methods and knowledge improved with experience, the diversity of complaints that could be treated with surgery increased. Walking upright is one of the main causes of many of the typical complaints we suffer from as human beings. That first step, taken by our ancestors 4 million years ago, brought with it a series of medical conditions that account for a large number of surgical interventions. Varicose veins, groin hernias, piles, impaired blood supply to the legs, intermittent claudication, wear and tear of hip and knee joints, arthrosis, spinal hernias, slipped discs, heartburn and torn menisci in the knees are all caused by our walking on 2 legs. 2 complaints that account for a significant part of a surgeon's work these days did not pose a serious threat to human life until relatively recently. Cancer and hardening of the arteries, arteriosclerosis, have made their way into our lives in the past couple of centuries, brought on by a lifestyle typified by a high-calorie diet and the consumption of tobacco. Furthermore, these diseases are usually contracted in later life, and in the past you would simply have died before you got cancer or your arteries blocked up. From the 19th century, people suddenly started to live longer due to a remarkable development in the Western world, which meant more for modern surgery than any great discovery or renowned surgeon you can name. People started to be more aware of hygiene. This led to a radical change in surgery. It is difficult